So today I will be checking Shane's flexion of the scapula, and I'll be using this Goniometer. So the main muscles that produce shoulder flexion, some of the primary muscles are the anterior deltoids and the pectoralis major. So Shane will be seated in an upright position. Just stay in upright position, and the Goniometer axis is at the central humeral head, which is here, and so keep that here, and a stationary arm will sit at the midline of the lateral trunk, just straight down here. So this will be sitting here. The movable arm will be at the axis of the humerus, and so the end fill is firm due to tension in the posterior joint capsule. Shoulder tension such as teres minor and the lats. So if you would like to raise your arm up, let me just leave my hand here. Okay, so if you just raise up until, raise your, one second, if you just raise this arm straight up, and when we feel some tension, so about here, you could stop there, so I'm starting to feel a bit of tension. I'm going to check with that right here. So the normal range of motion should be between 0 and 120, and Shane's range of motion is here. Is 110. So you can put your arm down, and so the convex concave rule is that the humeral head is convex and the glenoid fossa is concave. During flexion, the humeral head rolls anteriorly and glides posteriorly in this joint, and the plane of movement is in a sagittal plane. So another alternative of the shoulder flexion would be to have Shane lying supine with his knees bent to keep the back flat. The axis of the goniometer would be placed just below the acronym of the humeral head. The stationary arm would be aligned with the mid-axillary line of the thorax, and the movable arm would be also be lateral midline of the humerus.
Today I'm going to be measuring Joe's flexion at the elbow. The main muscles that produce the elbow's flexion are the bicep brachii, the brachialis and the brachiradialis. I'm going to have Joe lay down in a supine position, which she is, with the arm to her side and the forearm in a supinated position. So if you can lay your palm flat, please, facing towards the ceiling. I'm going to place the goniometer on the lateral epicondyle of the humerus, with the stationary arm aligned with the humerus pointing towards the atrium, whilst the moving arm is aligned with the radius pointing towards the radial stelloid process. Okay, if you could please lift your palm towards your elbow, towards your shoulder, making sure that your shoulder doesn't flex and you remain in your hand in a supinated position. The normal range of a flexion at the elbow is between 0 to 150 degrees, which Joe is reading at 140 degrees. The normal end feel should feel soft, and according to the convex and concave rule, the ulna is concave whilst the humerus is convex. When the ulna flexes, it glides in the same direction as the bone movement. And this would take place in a sagittal plane. Additionally to this method, if you'd like to sit back and get comfortable, in addition to this method, I could ask the Joe to stand up straight with her arms to the side, and I'd place the goniometer over the greater tubercle of the humerus with the stationary arm along the mid-axillary line of the thorax. The moving arm along the lateral midline of the humerus. I'd ask Jo to lift her arm up as far as possible without arching her back. At the end of the movement, I'd take the measurement. This occurs in a sagittal plane with a normal range of around 0 to 180 degrees. The end feel is likely to feel firm during flexion. The humeral head rolls laterally and glides posteriorly. This method is simple and in standing, but it could be less accurate than in a laid down position.
So now I'm going to be measuring Shane's ulnar deviation in his wrist. So Shane is positioned. He's seated right now with his forearm on the table here, and his forearm is pronated, and his hand is resting on the table. Wrist is neutral. His fingers are straight out and they are relaxed. So if you just relax your fingers, and the goniometer axis will be sitting over his capitate, which is this bone right here, and the stationary arm will be in the midline of the forearm. So we'll be placing this here, and the movable arm is over the long axis of the third metatarsal here. So that's how we're going to be measuring, and the end feel should feel firm due to the tension in the radial collateral ligament. Yeah. So I'm now going to place this just in the midline here. So Shane, if you would like to deviate your hands outwards towards your ulna, bring it all the way as far as you can. That's it, and relax. I'm just going to, so the normal range of motion should be between 0 to 30, and Shane is actually just under 30, so like 29 degrees in his hand. So also we will talk about the convex and concave rule, and this is the convex rule is the convex concave rule is that the radiocarpal joint is the concave, sorry, and the radius and the convex proximal row of carpi bones, if that makes sense. Let me start again. So yeah, so that's the convex rule is the radiocarpal joint has a concave radius, and the convex proximal row of carpi bones here are the convex. During ulnar deviation, the convex carpi roll towards the ulna and glide in the opposite direction towards the radius. Another alternative of the ulnar deviation is that the patient's forearm is kept in a neutral thumbs up with the wrist free at the table edge. So you just place it on the edge of the table. The goniometer axis is over the capitate, and stationary arm along the forearm, and the moving arm along the third metacarpal. I will ask the patient to move. If I had to use another alternative, I will then ask the patient to move the hand towards the little finger and then record the angle. The normal range is also between 0 and 30 with a firm end feel from the radial collateral ligament.